In times of crisis, we look to our leaders for inspiration, of course. Retired four-star General Stanley McChrystal is very familiar with the stresses of leadership during turbulent times. He commanded U.S. and international forces in Afghanistan, and he led Joint Special Operations Command, the nation's premier military counterterrorism force. In 2015, he also co-wrote Team of Teams, a book about leadership. He applied the lessons he learned fighting abroad to businesses, nonprofits, and other organizations. And General Stanley McChrystal joins us now from outside Washington, D.C. General, good morning. Thank you very much for being here.
Thanks for having me.
You know, President Trump right now is doing a very difficult thing. He's trying to balance a hopeful message for the country. We will get through this with the cold, hard realities that many of his medical advisors are giving him, which is this is going to get worse. What advice would you have for him as he tries to navigate those two poles and faces criticism that he's being way more hopeful than truthful?
Yeah, I think you could take some lessons from history. If we went to the beginning of the Civil War with Abraham Lincoln, or the beginning of the New Deal with Franklin Delano Roosevelt, or December 8th, 1941, what those leaders did was they outlined a difficult problem ahead. They exhibited confidence that we would come through in the end, but they didn't try to minimize it. They said it was going to be difficult. We were going to demand a lot of the American people and, of course, a lot of our leaders. And then they proceeded to live up to that. And that's what I think is needed right now.
Yeah, so why is candor so important?
Well, because you can lie to anybody for a little while, and then after a while, everybody figures it out, and your credibility goes down. Particularly if I think in combat, soldiers see what's happening on the ground. So trying to tell them it's different than it is a waste of time. So it's respect to be honest to people.
General, how do you get honest with people without spreading panic?
Well, the size of this kind of problem, particularly the different nature of it, the idea of pandemic, is a little bit frightening. So I think the first thing you do is you say, this is a big problem, but we are a big country. We are a big world. We can do this together. I think what you say is we are going to bring every resource, every leader, the capability of every part of our nation and the world against this problem. There'll be a little bit of panic on the part of people, but at the end of the day, if you don't exhibit this kind of focus, this kind of absolute commitment, they will fill their minds with all the things that frighten them.
I think you're so right about that. It reminds me of that famous line in the movie, "You can't handle the truth." We can handle the truth, and then we know exactly what we're dealing with. I think that that's very important, so you make a good point. But I love the tease that Tony said going to you, that you compare the government's response. This crisis reminds you to the early months of fighting al-Qaeda. What do you mean by that?
Well, there's a unique challenge to this. When we started fighting al-Qaeda in Iraq, they were a different kind of enemy. They were this vastly dispersed network organization that didn't follow traditional hierarchy, although most terrorist groups before that had. What we found is we were purpose-built to go after the traditional kind of terrorist groups. So what we had to do was geographically disperse ourselves over 76 different bases. We had to synchronize ourselves every day. So we became a virtual command, not because it was a great idea that one of us had, but because we had to do that. That's essentially what's happening right now. The coronavirus is a difficult economic problem, it's a difficult health problem, but it's creating a special dynamic, and that is the requirement to stay separated. Yeah. So businesses, government have all got to operate with people working from home in a new environment. We can do this, we know how to do this, but we've got to focus.
Well, General, you bring up an interesting point, which is the question of trade-offs. We are effectively sacrificing our economy and everybody in that economy for the sake of public health. That's a complicated equation. As somebody who I'm sure has had to make calculations regarding people's lives and safety, how do you balance, one, economic health, which can become public health, against lives and illness?
Yeah, the particular nature of this pandemic, in my view, requires it's the fire that's in front of us right now, and we have to get that under control, or it will burn for a tremendous amount of time. So I think that there's going to be short-term economic pain, and it's going to be significant. I think everybody knows that by now. But if we don't do the kinds of actions that are required, government intervention, stay at home, social distancing, then this thing could get much worse than it would be, and of course could last much, much longer than it should.
General, we know you're currently advising a local hospital. We've been talking all morning about the desperate need for supplies and resources that hospitals are experiencing. What is that hospital telling you? What are you telling them in a situation like this?
Well, it's interesting. It's a big hospital system, and what's going to happen is they are going to be overwhelmed, like all hospital systems. And I think what's going to happen is many of the workers are going to start to feel abandoned. They're going to be out there working tremendous number of hours. They're going to be at risk. They're going to be simultaneously worried about their families. They will probably be under-resourced in things they need. And there's a great potential for them to feel as though they're guilty, that they can't take care of people as well as they think that they should, but also that they're not being supported. We can go on TV and say how much we care for healthcare providers, but the reality is they will feel like soldiers on the front line who are not getting what they need. And so I think it's important for them to create communities of connection. The leadership of the hospital system, who's a very strong leader, Dr. Harrison.
General, forgive me, but
they've got to have a constant communication.
Forgive me, General, I apologize, we have to go.